If it's approved, I'm gonna say when it's approved, because I'm gonna be optimistic here. It's going to potentially revolutionize the treatment of mental health, because this is the first time we would ever have a drug therapy combo approved. And it bucks this, 20 or 30-year trend of, a simple drug for a simple bug, as they like to say, that you can just give someone a pill and it's magically going to correct the, neurochemical imbalances in your brain. And all your depression and issues are going to be washed away without actually dealing with those issues head on, which is what this therapy helps to catalyze.
That was Rachel Neuer, and this is episode 79.
Welcome to the Brave Woman Podcast. I'm your host, Tanya Lynn, founder of Sistership Circle and author of Open Your Heart and The Art of Leading Circle. I'm the mother of 2 girls, an 8 on the Enneagram, aka the Challenger, happily married to my business partner, Brent, love connecting with nature, and have put in well over 10,000 hours circling with other women. On this podcast, we will explore how to embody the brave woman so that you can take action on your dreams and desires, unapologetically speak your truth, and live life on your own terms. Grab a seat and a cup of tea, and let's get started.
I am really excited. I'm always excited, but I am especially excited for our guest today. And I want to introduce Rachel with her bio. So Rachel Nuwer is an award-winning freelance journalist who reports about science, travel, food, and adventure for the New York Times, National Geographic, Scientific American, and more. Her multi-award winning first book, Poached: Inside the Dark World of Wildlife Trafficking, was published in 2018. And her second book, I Feel Love, MDMA and the Quest for Connection in a Fractured World, was published in June 2023. And that's really what had me invite Rachel on today, because I read that book, could not put it down, completely devoured it. It was such a feel-good book, but also so educational. And so we're going to be talking about both of those things today. We're going to be talking about wildlife trafficking and MDMA and psychedelic therapy. So welcome, Rachel. Super excited to have you.
Likewise. Thank you. I'm really excited to be here.
Yes, it's different to have you here. We don't typically have journalists, and yet I'm so excited because I am a writer and a journalist, or was a journalist in high school and college myself.
So cool. Well, I'm really happy to be an ambassador for our kind.
Yay. Let's start with, let's talk a little bit about your journey and giving us some context of who you are and the things that you do in the world.
Yeah, absolutely. Well, the bio captured it. I'm a freelance science journalist, but the journey to find my way to this career has, had some twists and turns. So some background: I grew up in Biloxi, Mississippi, on the Gulf Coast, about as deep south as you can get. And I was raised in a household with a mom who absolutely loved animals. And if anyone who knew us found like a baby squirrel that had fallen out of a nest, or a stray kitten, or had purchased an iguana for their kid and realized, whoops, we don't need this iguana, they would bring those animals to our home. So I grew up with this deep appreciation and fondness for animals as individuals. At the same time, there was this wonderful patch of woods near our house, which very, very sadly has since been cut down. But I spent my childhood exploring those woods, and also did things like sea camp. So I really loved ecology. I loved environment. So I had both this appreciation for animals as individuals and this appreciation for the wider ecosystems where they live. So when it came time to go to college, I had to choose a major. And I had always been really good at writing, reading. I was the kid who would write stories in my free time to share them with my friends. But I felt like majoring in English would be not quote unquote serious enough, a career move. So I thought, okay, how can I be like a serious adult now? Oh, I'll major in science and I will become a conservation biologist. That way I can help protect those species and those ecosystems that I really, really dearly love. The only problem with this plan, and it became pretty apparent as I progressed through my undergraduate and then graduate degree in ecology, was that I just suck at math. Like, I'm really bad at math. I even had a chemistry teacher ask me if I had a math learning disability. Like, it's bad. And I was trying to kind of ignore this fact about myself and just push through, but it was just becoming increasingly apparent to me that I would not make a good scientist because I would never be able to really crunch my own data. So while I was kind of struggling with this problem, I heard in my stream ecology class a professor mentioned this thing called science journalism, and I'd literally never even heard of science journalism. I didn't know it was a thing, and he kind of like dismissed it, saying, "Oh, science journalism, that's for these liberal arts people, not us like serious scientists." And I just thought, like, oh my God, he's talking to me. I'm like this like scientific fraud, this journalist like hiding in this class of scientists. So I went home that afternoon and Googled science journalism and wound up applying to a program here in New York City at NYU, and went straight from my ecology master's degree to a master's degree here in New York. And yeah, it wound up working out. I've really found my niche.
And I love how that merged the two loves. You were thinking about doing English and your love for
Exactly.
writing. I mean, I love that. I love that.
Exactly. I mean, I found
Collision.
like it was like a perfect compromise for me. And, I should have mentioned one of the reasons that I really chose to pivot in this way is because I felt like writing about the things I care about would be the way that I could personally affect the most positive change in the world. And that was always my goal all along.
Mm. So what do we need to know about wildlife trafficking?
Oh gosh. Wildlife trafficking. Okay, I can do my little spiel about like why this is a big problem that we all need to be aware of and,
Yes.
make sensible choices around. So wildlife trafficking is a multi-billion-dollar illegal commerce. It's actually ranked only third in like most profitable illegal enterprises behind arms and drugs trafficking. So it's this tremendously huge problem that affects virtually every country around the world that is either a source, a supplier of wildlife, a conduit through which wildlife moves through, or a final destination, or all three sometimes. And unfortunately, despite the immensity of this problem, we really don't take it seriously because it's like over here, it's affecting animals. And like we all love animals, but we just do not, consider them on the same level as we do human issues. So it's chronically underfunded. And as a result, the people who are committing these crimes really oftentimes do so with impunity, especially in countries outside of the US. There has been some positive change in recent years, like China, for example, which is the biggest destination for wildlife trade, illegal wildlife trade. They banned ivory a few years ago, and that's had a really positive effect on elephant poaching in Africa, but it hasn't solved the problem. There's still underlying demand, especially in places where trafficking is less policed, like Vietnam, for example.
And so for those of us who perhaps aren't as aware, how can I support this? Like what can I do to support this movement?
Yeah, such a good question. I mean, like sitting here in the US or, wherever, it's easy to kind of throw up our hands and say, this is a problem that's like affecting developing countries, or, it's, pointing fingers at Asia and consumers there. But there are things we can do in our daily life to try to combat this. I mean, voting is a big one, or letting your political representatives know that you care about this issue, because the US is one of the biggest countries in terms of support of curtailing this, providing funding to other countries to stop it, sending fish and wildlife agents abroad as attaches to live in places where there is high wildlife crime. And that program is constantly under threat, from budget cuts. So, voting on political representatives, talking to them. If you have the personal means to do so, you can contribute to great nonprofits that work on this issue. Not all of them are cut from the same cloth. So, if anyone's interested, they can email me at rachelnewer@gmail.com, and I can recommend specific nonprofits that do excellent work. And oftentimes these are like local nonprofits in a country that you've never heard of, but just like, dedicating their lives to this issue. And then there's just common sense things like, not liking or sharing on social media videos of animals being exploited. Like you might think that slow loris being, quote unquote, tickled is cute, but it's actually like trafficked from the wild, and it's like putting its little arms up because it's like in great fear. So it's basically being tortured.
Mm.
Or, if you take a vacation to Thailand, like don't go to the tiger quote unquote sanctuary, which is actually just a big front for trafficking tiger cubs out the back door to be slaughtered and have their bones harvested once they get too big to be cuddled in tourist photos.
Oh, thank you for sharing that. Actually, we could put some of those in the show notes. So
Oh,
I'll grab
cool.
some of
Yeah, that
those
would be great.
nonprofit links. Yeah.
Nice.
Okay, so now we've switched. You're now writing about MDMA and
Yeah.
psychedelic therapy. So first of all, how did you get into this, and what made you start to go down this path?
Totally. Great question. It was not an expected path for me. So I did that program at NYU in science journalism, and I really came out of the program with this like focus on wildlife trade. I was like, I want to be like a wildlife trade person. I want to write a book about wildlife trade, which I did. That book came out in 2018, as you mentioned. And, especially after my book came out, I started just kind of being the go-to for editors, whether at New York Times, National Geographic, Scientific American, for writing about this issue. So I was, cranking out stories about wildlife trade all the time. But I was feeling like after a while, I was just sort of writing the same story over and over again. It's like, okay, the animals or the players or the country are changing, but it's just like, okay, humans destroying our planet. And it was starting to become a big bummer for me. And I also was just sort of craving change, craving a new intellectual challenge because, these stories were important, but I felt like also they weren't really moving the needle on this issue. Like I felt like I was preaching to the choir a lot, like the people who care about this stuff are the people who read it and nothing's really changing. And I know it's hard to measure change like that, but that's just how I was feeling. Then the pandemic hit, and I was here in New York City, and we had, very strict lockdown, and all these like exciting international trips I had lined up were canceled. We had no idea how long it was going to last. I mean, like, it's just so strange to look back on those days and try to put myself back in that mentality. But I was feeling just kind of like I was like drifting without any tether. And I also had, like a lot of people, a lot more time to think about what I was doing with my career, what I wanted out of life. And yeah, it really crystallized in my mind that I was wanting a break from wildlife trade. And okay, full disclosure, I was on MDMA at the time. One of the times when I was thinking about this question, I was sitting there on my couch and in popped into my head, hey, why don't you just write a book about MDMA? And, I was like, hi. And I was like, oh, that'd be a cool idea. Yeah, MDMA. And Donna Summer's song, I Feel Love, came on. And I was like, oh, that's my title. So I had the idea for the book and the idea for the title that same night when I was like rolling on MDMA. And then, of course, the next day when I was sobered up, I actually started doing real research and found out that there wasn't a book that really a contemporary book that really brought the whole story together, which is how I found my way to this new topic.
Amazing. I love it.
Yeah.
So I'm curious, your story, since we're in full disclosure here, and this is the Brave Woman podcast. So
yeah.
when did you discover MDMA?
Yeah. So I was born in 1985, so I grew up like fully a dare say no to drugs kid. I thought my dare Officer Wynn, was like so cool, and I thought like those people who do drugs are just losers. And I had profoundly no interest in drugs. I didn't even drink alcohol until like late in college, and it's hard to really recollect how that changed. I mean, I took mushrooms in college, which was like a very eye-opening experience. And for some reason, I just didn't attach that mental stigma to mushrooms as I did to some other drugs. Really, actually, this was for MDMA in particular. Very sadly, a friend's brother committed suicide when I was an undergraduate freshman. And everybody, instead of looking at the underlying drivers of what had caused him to make this choice, blamed MDMA because he had been doing MDMA on the weekends. And, they're like, oh, this evil drug MDMA, it caused his moods to crash. I mean, he became so sad because of this drug that he killed himself. And everyone just accepted this story on face value, and I did too, because I didn't know anything about it. And I'd been conditioned to think of drugs as, these evil things that can literally like turn you into a different person. So yeah, I did the mushrooms in college, and that was eye-opening in terms of how interesting it can be to just have an experience of altered consciousness. And moved to New York, met my current husband, who happened to be a raver kid in the 1990s. He's a
Oh
little
my
bit
God,
older than
sounds
me.
like my relationship.
Oh my God. I want to hear about this. So yeah, Paul was like a former raver kid, would go to like these warehouse parties in Denver when he was like 18 and 19. And really, ecstasy was the drug that fueled those nights. There wasn't even alcohol in the premises. And the stories he told were just so uplifting, and it sounded so fun, and it sounded nothing like what I had been told about ecstasy. So eventually I guess I was getting like bored enough with life that I just wanted to try something new.
Hmm. And
Oh, okay. Yeah. And so I started telling Paul, like, I want to try ecstasy. And he's like, really? I haven't done that in like 15 odd years, but I would try it with you. So we started like really like nerdily asking around. Like, I remember we were in a bowling league, and we asked the bowling league head, because he looked kind of edgy, like, hey, do you know where we can find some ecstasy? And he kind of looked at us and he's like, guys, it's called Molly now. It was like, oh, thanks. Eventually we found some through like a friend of a friend. The first time I tried it, I had zero effects, because now I'm extremely diligent about testing my drugs, weighing my drugs. Like I have a whole, set of things I go through to make sure I'm actually doing what I want to do and the amount I want to do. But at the time, we're just kind of eyeballing it. So I think that first time I didn't take enough. But yeah, the second time I finally got the effect. We were at a warehouse party in Brooklyn, and it was so fun. Like, I think for anyone who's done MDMA recreationally and had a good time, I mean, I think the vast majority of people do, just that first time, that wonderful feeling of just kind of letting go of your anxieties, like being fully in the moment, clicking with the music if you're at a rave, and just like vibing with all the people around you in this non-self-conscious way. And especially if you're with friends or people you love, like the group hugs, the smiles. It was just such a very positive experience. And I definitely, all my misconceptions about MDMA were completely erased, and I wanted to do it more. But the one of the I think assets of MDMA is that people don't do it like every day. You're not like, oh, that was a great bottle of wine. Now I'm going to have another bottle of wine the next day and the next day. It's a big experience. You wake up exhausted the next day because you've been dancing all night, if that's the route you take it. And it's not like this thing that you crave all the time. And if you do happen to take it, quote unquote, too much, your body will let you know, because it will stop having those positive effects. You'll be left with those speedy effects of the methamphetamine part of MDMA, which is, the jaw grinding, the kind of twitchiness, and you'll lose that euphoria. And scientists don't know why that happens, but I think it's definitely a clear effect. And that's why people kind of get burnt out on the raving thing. They grow out of it, they lose that magic. And yeah, so I became an MDMA user, but with constraint, once every 3 or 4 months maximum.
As you're speaking, I'm literally having a body experience right now
Oh my
of like
gosh, how
actually
so?
feeling. Yeah,
Oh,
as you were like talking about it, I just had this full wave
oh my gosh.
wash over me. And it would be interesting because as if we were going to do it, um, leading up to it, I would have the effects already,
Oh
or I would
yeah.
listen to a
Yep.
song and I
Yep.
would like have this full body wave.
Oh
So
wow.
it's fascinating to me how I can like pick up on it
Plug
and not
into
even
it.
be on it. Yeah.
Oh wow. Am I allowed to
So
ask you questions? I'm actually really curious
yes.
about your first time, or we can keep the
Yeah,
focus on me, but
yeah.
I like really want to know this now.
Yeah. So this was about a couple months into my relationship with Brent, and before we got married. So we did it just the two of us at his apartment.
Nice.
And we set this beautiful sacred space, and I think it's honestly what had us then like fall in love and want to
Wow.
be together and get married. I mean, it was immediate. So there was just such a beautiful bonding
Mm.
that really happened between us. And then I got pregnant 3 months after meeting him. So I mean, we were all in for all life.
Nice. Nice.
But this has been something for us that we have tried to be consistent with, of doing it in sacred ceremony together, just the two of us. And what ends up happening is a lot of times the beginning is releasing. It's almost like we have to clear out
Mm-hmm.
before we could then connect. So it's been extremely powerful medicine for us in our relationship of really letting go of the stuff that's kind of, getting icky,
So
and
great.
then remembering who we are and remembering our divine connection, and that we are soulmates and we are here for something bigger. And the most profound experience was during our anniversary weekend in November 2020, where he had this experience where he went somewhere, and he says it was like having an ayahuasca journey,
Mm.
which sometimes you don't think about MDMA in that way, but it is a psychedelic.
Yeah, it can be
And
profoundly psychedelic.
I mean, his eyes were rolling in the back of his head. He was somewhere completely else, and I was just holding space.
Mm-hmm.
And so it's like he went somewhere, and then he came back, and he basically was having these past life and future visions. And he said, "We're going to Costa Rica, and we're going now."
Oh, wow.
And I was like, "Okay." So in less than a month, we packed up all of our things and moved down to Costa Rica. And now we're building a retreat center down there.
Wow.
And yeah, so and he's always like, "I've always wanted to have an experience like this."
Oh, wow.
And interestingly, at Burning Man the summer before that,
Mm-hmm.
I had a really powerful experience where I went somewhere else.
On MDMA.
Mhm.
Wow.
And so he was like, "I want that," because he was the raver kid at 18 years old, living in Japan in the Navy,
Oh, wow.
stationed in Japan, doing MDMA quite frequently. And he's like,
What
"But
a
I always
place for
wanted
it.
like the spiritual experience where I'm going down some portal into some other dimension." And so he was really excited that he got to have that.
Fantastic.
But yeah, it's been so powerful. So for me, starting to hear that people were using it, or therapists were using it for therapeutic purposes, I was like, "Oh yeah, well,
Mm-hmm.
yeah, I
Mm-hmm.
know from my own
Oh,
experience
yeah.
that it's extremely healing, and that it's not just a fun party drug, because of the profound experiences that I have had of deep release, deep crying,
Mm-hmm.
just,
Mm-hmm.
and Brent as well. So,
Yeah.
and so, one of the things that you just mentioned and that you talk about in the book is the importance of testing, because so much of it is just not even the real thing.
Mm-hmm.
So, I'd love for you to share a little bit about that. And also, how does someone like me can I do my own testing? Like, how do I do that to be more safe and make sure that I'm getting quality medicine?
Yeah, I'm really happy that we're talking about this. I'll share a story that made me realize the importance of testing. I think a lot of people wind up having this kind of experience. I was in London, Halloween. A friend procured some MDMA, and again, just my typical like eyeballing the bag and throwing it in a drink and like chugging down that terrible bitter tasting stuff. And I had done it a few times by this time. I'm like, okay, I know what I'm doing. And I was standing at the bar waiting for a drink, and it hit me so hard I felt like my body was lifting off the ground, and I like ran back to Paul because again, 90s raver kid. And I was like, oh my God, like this is hitting me too hard. Like what's going on? And he's like, okay, let's get you on to the dance floor. But the rest of the night is literally just a blur. Like I had, blackouts. I can remember like literally blurs here and there of people's faces on the dance floor blurring. He had the same effect, which makes me think that it wasn't MDMA, that it was some kind of like speed or like some kind of, I don't even know. We like weren't able to get to sleep that morning at all. I think we wound up going to sleep at like noon, which isn't normal. And I had just like chewed the entire inside of my cheeks and bit in my tongue. And, it was just like extremely unpleasant. And I was like, I never want that to happen again. So I started with home tests, which you can get from places like Dance Safe. You can just order them online. They're really easy to use. You even like feel kind of cool doing some chemistry in your kitchen. But after I wrote this book, I really wanted to kind of like step it up in terms of what I was getting and like knowing exactly what I was putting into my body. And in my reporting, one of the people I interviewed from the Netherlands told me about this nonprofit in Spain called International Energy Control. And I can share the link with you after this talk so that you can share it with listeners. But they're basically a lab that you can mail small samples of whatever pill, powder, drug you have to. And, you pay them a fee. It's like $70. And they will do lab grade testing for you, not only to find out if there are adulterants, but also to tell you the percentage purity of what you're sending in. So I now send them every new batch of MDMA I get. And, I've gotten no adulterants so far, which is great. It also reflects the fact that a lot of the MDMA out there these days is, unlike when I did it in 2015 in London, pure stuff. But, the percentage purity will range from like, I think 68% was the lowest I ever got to 88% was the best I got. And as I said earlier, I only do MDMA once every 3 or 4 months. And when I do it, I want to have like that good time that I'm aiming for. So I want to calibrate my dose to get exactly the milligrams that I want. So knowing that percentage purity allows me to then make up for, that inert filler and have the experience that I'm seeking rather than just kind of like, not really getting to cruising altitude.
Great. Okay. So we'll put those in the show notes. And so, yeah, you share the whole history, which is just so fascinating. You interviewed a bunch of the big players. For you, and now, well, actually, let's just start here of, the U.S. is this year potentially legalizing it for therapeutic purposes. And so, some big news just came out. I know that this isn't going live for a month, but yeah, tell us where we're at with getting it legalized. And for you, like why it should get legalized.
Yeah. So we're here chatting on June 5th. And I think this will drop in about a month in July. So it's actually a really good time for listeners to hear this update. Let me back up a little bit. So for a new drug to be approved, the Food and Drug Administration here in the US requires clinical trials. And there's 3 stages of clinical trials, and these are set up to test a new drug's safety and its efficacy. Does it work? And one of the ways to determine if a new drug works, as established by Western medicine protocols a few decades ago, is this concept of double-blind, placebo, randomized clinical trials. So, half the people get a placebo, and the other half get an active drug. And nobody knows. The people doing the test don't know, and the people receiving the therapy don't know, for the treatment, who gets what. Okay, so all the clinical trials have been done for MDMA, and the results, and this is for PTSD, by the way, the results have just been like shockingly spectacular, like better than any treatment we have for PTSD, like by a long shot. So 2/3 of the participants in both of these clinical trials came out no longer even having a PTSD diagnosis. And we're talking about people who had oftentimes extremely intractable PTSD. On average, they'd been diagnosed like for 16 years. They'd tried everything. They tried therapy, they tried pills, and they were getting no relief. And it was absolutely, ruining their lives and, ruining the lives of the people around them as well. So really spectacular results. So when that second phase 3 trial was published last year, people were like, okay, this is a shoo-in. Like the FDA is going to approve it. The FDA granted expedited review, which they do for treatments that show promise for like the worst diseases that we need treatments for, which means the FDA's decision is due August 11th of this year. And the group that ran these clinical trials has been working with the FDA closely, literally for the past 23 years, to design these trials so that this would satisfy, the federal government, working very closely to figure out, how many people we need, like what efficacy do we need to show, like blah, 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 every detail cleared with the FDA. Well, there was a public advisory committee meeting yesterday, which isn't something that the FDA is obligated to do, but it's sort of like socially obligated to do for a treatment like this that's such a like potential revolution in psychiatry and mental health. So this was a meeting that consisted of 11 experts, sort of establishment experts from psychiatry, who sat around a table and debated the merits of MDMA-assisted therapy. And these aren't people with deep knowledge of MDMA or the history of MDMA or how this even works mechanistically. They're people just, I don't know how they're selected. But anyway, long story short, the review committee meeting did not go well. They were very critical. It was kind of like they were competing to see who could have like the most number of criticisms of these clinical trials. And Lykos, the pharmaceutical company that's trying to bring MDMA to market, wasn't given a chance to really respond. But the end result was that this advisory committee voted not to move forward with MDMA-assisted therapy. Now, what's kind of been missed in a lot of the headlines and in public understanding of this issue is that this is an advisory committee, and literally this is their advice to the FDA. This isn't a binding decision in any sense. However, if you look historically, the FDA does go with the advice of these committees 67% of the time when it's a negative decision. So basically that means that MDMA has like a 1 out of 3 chance of getting passed in August. And honestly, I think because it is such a new treatment, like it's got that going against it as well. On the other hand, the FDA has been working very closely with the sponsor on this, like I said, and it does kind of seem like if they weren't into this and weren't enthusiastic, they wouldn't have come all this way with it and given it all these expedited reviews. And we'll just see. We will see what happens in August. But I will say the psychedelic community is like not having a good day today. And, we'll see.
So what do you think? Why is it important for the FDA to legalize this?
Oh, right. Yeah, I forgot that other part of the question, which is a really good one. So like I said, the clinical trial results just show this incredible efficacy. And one of the issues, the reason I brought up that blinding, one of the big issues that the advisory committee really latched onto was the problem that most people who got the MDMA or who got the placebo were able to correctly guess which group they were in, which is like, yeah, like no duh. Like it's a mind altering drug. Like how are you supposed to control for this? So, it's like they're like trying to fit like a circle shaped peg into like a square shaped box or whatever. Like we need a new like paradigm for testing psychedelics scientifically, if we're going to put them through this Western model of validation, which is important, but they don't fit. They're not like, a new chemotherapy or something. So anyway, they were latched onto this issue of, okay, well, if people were able to guess, then we can't actually say that this actually works. It can just be a placebo effect where people like are making themselves get better because they got the MDMA and they think like, oh, I got this magical treatment. I really don't think the data bear that out. There was such a huge effect statistically that it just doesn't, like placebo cannot account for how big this effect was. And we have 40 years of anecdotal data as well at this point. There's before MDMA was criminalized, people did research on it with couples therapy, with trauma, with personal growth, and found incredible results some of the time. People after it was criminalized have been practicing underground MDMA-assisted therapy. So there's a lot of anecdotal evidence from the underground. And to be honest, I've seen the effects personally myself. I've seen it through the interviews I've conducted with people that are just like so powerful. I'm literally like left in tears at the end of these interviews.
Can you share? I mean, that was one of the most inspiring parts of the book.
Mm-hmm.
Was you shared some of these stories of these people who were like, there's no hope left.
Yeah.
My PTSD is so bad. There is no hope left.
Yeah.
I have tried everything. And just from doing MDMA assisted therapy, lives altered drastically. So you want to share one of those stories?
Yeah, sure. I'll share a story, but before I go there, I will say during the panel yesterday, this advisory committee thing, they had like public comments, and some of the people were sharing those stories, and literally you're hearing from like US veterans who fought for our country and whose voices are cracking with emotion, sharing their stories. And I just don't know how you can hear those stories and then be like, but they knew what they got in the trial. Anyway, so which of these stories to choose? I think Lori Tipton's story is like the most just devastating that I heard of the people I interviewed. She's a woman in New Orleans, which is close to my heart, being a Southerner, and I did my undergrad in New Orleans. And her life, like, if it wouldn't even work as a movie because it's too many bad things happening to a single person to even make sense. It's like, okay, this is like unrealistic. She grew up with a mom who was bipolar, so she already had the childhood trauma. Her brother overdosed and died on his birthday at her house. He, went out drinking and then took a pill and never woke up. Her mom wound up killing herself and killing two other women, a double murder suicide. It was like a love triangle gone wrong. About a month later, Hurricane Katrina hit. After that happened to Lori. She started spiraling after that, just self-medicating with alcohol and with pills. And then on top of all of this, she wound up getting raped by someone she knows from work, getting pregnant with her rapist child, going to get an abortion, and being chided and judged by the nurse who was giving her the abortion. And, this was like over years, and Lori was just like basically surviving, but not really having a life, not really like surviving as a human. Like she wasn't feeling anything, and also she couldn't have sex anymore because she would be sent into a panic attack. So she couldn't enjoy normal relationships. She was, just PTSD, like startled by anything, constant vigilance, paranoia, nightmares, couldn't sleep, and just kind of going through the motions of her life without getting any sort of feeling or enjoyment out of it. She even wound up having a child, and she was either super paranoid about, like a branch is going to hit my kid and kill him, or like this dog's going to attack my kid, like always worrying about the baby, but at the same time looking at her beautiful baby and not being able to feel any joy or love, just feeling like numb and thinking like, I want to kill myself because I just can't feel anything. And like so many people in these trials, Lori had tried like everything, from like yoga and acupuncture to therapy and medications. And it just was not working at all for her because she would just like disassociate when she's telling the story, almost like it was happening to someone else. She couldn't like feel like what had happened to her. And then she was scrolling on Facebook one night and saw an ad for MDMA assisted therapy trial recruitment and was like, what the heck? I'm going to try this. Like, I've never done ecstasy, but like, I will literally try anything. So she enrolled, she was put into the active experimental arm. And yeah, it really changed her life. She was able to, in her first session, like revisit these beautiful memories she had with her brother when they were kids and really like feel that loss. Her second session, she went back to the scene of her mom, of discovering her mom's body with those two women that she murdered, and just again feeling compassion for herself for like, oh my God, like having to see this, but also feeling compassion for her mom, and her mom having gone through her entire life with this debilitating mental condition, just feeling this frustration and anger that had led her to this horrible choice, and thinking, if my mom could have had this therapy, maybe she would have been saved and maybe things would have gone differently. And then her last session was really dealing with the rape, and her therapists had her do a yoga position. I can't remember what it was. I'm not a yoga person, but a yoga position that had sent her into a panic attack every time she did it. And she was a certified yoga teacher because it reminded her of her rape. And she was able to, work through that and, with like a lot of emotion, just come to terms with the fact that it wasn't her fault that this had happened to her, and, that she could forgive this whole situation and be okay with it. So Lori today is just amazing. We actually did a book talk together. She like interviewed me. It was so wonderful to share the stage with her. And she's, she's thriving as a mom. She's the first to say that this isn't some magic treatment. It didn't make her life perfect. It didn't rid her completely of PTSD, but she's able to manage those symptoms now and like feel things and just, be embodied in a way that she wasn't before. And I'm also just super impressed with her because she's doing a lot of psychedelic advocacy. She works with the Psychedelic Association in New Orleans and is just like this huge advocate for making this therapy legal so that others can enjoy the same healing that she did. And she actually did share part of her story in the public speaking part of the advisory committee meeting yesterday. And, I texted her and was like, wow, you did so great. Yeah. So, yeah, Lori.
Yeah. I mean, and it's the first thing that actually worked. Yes, she might not be perfectly cured. Yes, it might not have, she might still have some PTSD, but like the needle moved.
Exactly. Yeah. Like she's a functioning human now who can feel things and enjoy her life. And yeah.
And countless stories are the same as Lori's.
Mm-hmm.
So yeah, this is paradigm shifting in such a big way for the FDA or for MDMA to be legalized and to shift just mental health, period.
Oh yeah. This if it's approved, I'm gonna say when it's approved, because I'm gonna be optimistic here. It's going to potentially revolutionize the treatment of mental health because this is the first time we would ever have a drug therapy combo approved. And it bucks this, 20 or 30 year trend of, a simple drug for a simple bug, as they like to say, that you can just give someone a pill and it's magically going to correct the, neurochemical imbalances in your brain. And all your depression and issues are going to be washed away without actually dealing with those issues head on, which is what this therapy helps to catalyze.
Yeah. Well, thank you for being a brave woman and writing about this and educating people, because like you said, for those of us who grew up in the 80s,
yeah,
drugs are bad.
Yep.
This is your brain on drug,
Oh yeah. Holes in the brain, Swiss cheese, all the stuff.
Mm-hmm. Yeah. And so, people are waking up, consciousness is changing. And, it's just, I can see so many people around me open to these drugs that were labeled as so bad and evil now being used as medicine. And what I love about the book is that you're talking about, some of the dangers and some of the things for us to be aware of that could potentially go wrong. And so again, it's not a magic pill. It's also, we don't want to use it as a drug. Like there's a difference between a medicine and a drug. And so some of the dangers around that. So yeah, I just appreciate the work that you put out there. And kind of in closing, I want to just have you share what it means to be a brave woman, and the women who are listening to this. It can be really challenging to go out there and feel like you're making a difference.
Oh yeah.
And this is part of your piece of making a difference in the world of publishing this book and putting It takes a lot to write a book.
Yeah, for sure.
So yeah, what does it mean to be a brave woman, and how can we inspire these women to go out there and make change?
Absolutely. Yeah. I mean, I thought about that question a little bit before our call, given the podcast and everything. I mean,
Yeah.
it sounds cheesy, but I think it's all about just kind of owning and making your own destiny, whatever, your heart tells you that is, and following your instincts and not being afraid to make dramatic changes for yourself if you feel like things aren't working. Like I made that pivot early on from science, and I was midway through my master's degree in ecology. It felt like, oh God, am I a failure for giving up on science and trying this new thing? I pivoted again into the psychedelic science realm, which I knew nothing about neuroscience and had to start, from the bottom up. But I think it can pay off to believe in yourself and to make those bold choices and to stay true to yourself. And it's absolutely not easy to do that. Like I doubt myself and my decisions all the time, but at the end of the day, looking back on what I've accomplished so far, I mean, I think it's going relatively well. So yeah, that's my 2 cents.
Thank you. Thank you so much for being here.
Of course.
And thank you everyone for listening to the Brave Woman podcast, and we'll see you next time.
Thank you.
You just listened to this show. I'd love for you to leave the Brave Woman podcast an honest review. Reviews help podcasts like this one grow, making it more possible for me to devote my time, energy, and money to its production. If you take a screenshot of your review and email it to support@sistershipcircle.com, we'll send you one of our archetype activations as a thank you gift. Thank you so much for your support. I really appreciate it.
Up next, cacao has become one of the favorite medicines to use in ceremony, and for good reason. But before you start working with it, there's some things you need to know. Join me next week as I introduce you to Dia, cacao sorceress from Ecuador, who has made it her life purpose to work with this plant ally and source the best cacao from her native land.